This is the beginning of Module 2 of your Emergency Medicine Orientation podcast. We will be covering general educational objectives for the rotation. First, I'd like to say the most important aspect of the rotation is performing or learning to perform an accurate and appropriate history and focused physical exam on a patient presenting to the ED. I can't think of a more important skill or skills to learn than getting that history and exam. As many of you have been told on prior rotations, it's about 80% of the diagnosis will be from the history alone. So you have to be good at getting a good history. And this takes time. It doesn't happen overnight. And sometimes it takes years to be able to learn this skill. But I would say this educational objective is by far the most important of all. For example, if someone comes in with, quote, chest pain, and you ask the patient, do you have any chest pain? And they say no. They may not think of their symptom as a pain. If you have any chest symptoms, they may say, sure, I have this slight discomfort or achiness in my chest. That might be their heart attack. Had you not asked it in that way, you may have missed that key aspect of the history. It's important that you be very thorough with your physical examination and focused. For example, if somebody comes in with an ankle sprain, I would not expect you to do a complete neurological examination. However, if they fell down a series of steps and hit their head as well as sprained their ankle and were altered in their mental status, then I would expect you to perform a thorough and complete neurological exam. Moving on to the next educational objective, utilizing the lab and X-ray department. This is also a very important principle, testing. Junior residents and students have a tendency to overtest their patients. That's just natural. What I'd like you to learn is the principle of less is more, using clinical decision rules and risk stratification. There are many clinical decision rules available to you, from the Wells score, the PERC rule, the TIMI score, among many others. And I'd like you to use these rules or scores to risk stratify your patients. For example, if a patient comes in with an ankle injury, utilize the Ottawa ankle rules to determine if they would need an X-ray or not. But it's important that you grasp the concept of relying on your history and exam and let that drive your testing, not the other way around. Remember that every test that you order keeps the patient in the department that much longer and may not be necessary. If a patient comes in with flu symptoms, fever, headache, myalgias, and it's January, you probably don't need to order anything. If a patient comes in with vomiting and diarrhea for several hours, but their vital signs are stable, again, you probably don't need to check those electrolytes or a CBC. It's important that you be judicious in your test ordering and be able to say, how will this change my management by ordering that test, rather than just doing the knee-jerk ordering of the tests. This goes for the radiology department as well. So remember, less is more. Use your history, use your exam, use those clinical decision rules to help guide your testing. Under 3, we want you to learn to review all your plain radiography and CT scans of your patients presenting in the emergency department. Try to get away from the habit of reviewing the radiologist's report, but look at your own films. Sit down with your attending or your senior resident and review those x-rays or CAT scans. I understand that it's challenging to read a CAT scan, particularly an abdominal CAT scan or a chest CT. But this will be the start of your learning experience in radiology. Under 4, review all the EKGs of your patients and be able to have a basic understanding of EKG interpretation. As you get better on the rotation, you might be able to utilize more resources which will teach you advanced EKG interpretation skills, like the Amalma 2 podcasts available on our digital library website. It's important that each of you have a fundamental understanding of reading an EKG. First, looking at the rate, the rhythm, the axis, the intervals, and any ST changes that might be there. As I will mention later, I will want you to review the Michelle Lin podcast that is on our student website on EKG interpretation. This will help you in this area. Under 5, I want you to recognize the importance of the team concept in caring for a patient. Paramedic, nurse, and physician working together for the patient's benefit. This is critical and essential. Remember that we are a team, and the paramedic is just as important as the physician in caring for the patient. And many times we'll have critical historical points that with regard to the patient. Nurses are critical to the operation of the department, and you need to treat everyone with respect. When the medic drops the patient off, talk to them, thank them, appreciate what they do. Paramedics are underpaid and overworked, and many times underappreciated. Under 6, we want you to learn the art of triage. Again, determining the priority of patient care, as well as ascertaining which problem gets priority treatment in a patient with multiple problems. The 5 ESI levels, which were covered earlier, are important for you to understand. This stands for Emergency Severity Index Score. Remember again that a 1 means the patient's really sick, and a 5 means that their complaint is very benign, whether it's a rash or some post-exposure prophylaxis treatment they need. Please review the appendix in your orientation handbook with regard to the ESI. Remember that pain management is critical in the pediatric and adult patient. This is the next objective I'd like to cover, and that the principles of pain management in the pediatric adult patient and how to interact appropriately with these patients. I want you to have a better understanding of the pharmacodynamics, in other words, how a drug works, and the pharmacokinetics of how a drug is metabolized when controlling people's pain, both in the pediatric and adult population. Remember, there are a variety of drugs that we use, like morphine, fentanyl, Toradol, Dilaudid, that we use to control people's pain in the emergency department. I want you to understand, when would you give something PO versus IV? Understand that fentanyl does not cause much histamine release, if any, and thus it's more cardiovascularly stable than morphine, which causes significant histamine release and can cause hypotension and rashes, as well as nausea and vomiting. Understand that fentanyl has a very short half-life, lasting maybe 30 to 45 minutes, whereas morphine may last several hours. And utilize those drugs appropriately depending on the situation. For example, if you're reducing a shoulder, you might only need to use a short-acting drug like fentanyl, which almost works immediately, crossing the blood-brain barrier in 90 seconds and lasts not more than 30 to 45 minutes. However, if you have somebody with a broken leg, they might need longer periods of analgesia, and morphine would be a more appropriate choice, keeping in mind that morphine takes several minutes to work maybe 5, 10, even 15 minutes to start working. I just need for you to have a better understanding of how to utilize these drugs. Remember that when people come into the department in pain, we need to control their pain. Don't spend time trying to get a history from a patient who's writhing around on the gurney with a kidney stone. Get your attending involved immediately to address that patient's pain. The last thing we want is a patient not having their pain controlled. And how to interact with these people appropriately. Remember that the Press Ganey improvement tips will be very helpful to you. When you come into a room, introduce yourself. Sit down and try to touch the patient. Again, patients will form an impression of you within a very short period of time, perhaps even as quickly as 10 seconds. So your entrance into the room is very, very important, and how you carry yourself, your body language, the tone of your voice. Those are the things that count the most. And so you want to enter that room like it's the opening night on Broadway. That opening and your entrance is critical. Let the patient talk. Let them tell their story. Try not to interrupt. Address them as ma'am and sir. And shake their hands. Shake everybody's hand in the room. And address all the family members in the room. Offer them a pillow or a blanket if they need one. Be kind. Be courteous. Treat them like you would want one of your family members be treated. Again, these tips are included in the Press Ganey appendix, so please review them. Next, I want you to understand the indications and practice of procedural sedation and analgesia in the pediatric and adult patients. At least once per shift, you will probably be doing some form of sedation or analgesia for your patients. There are many drugs that we use, from moderate sedatives like Versed or Valium to deep sedatives like propofol and etomidate. If you have further interest in this area, there are e-learning modules on our LVHN website that you will have access to. I'd like you to get exposure to how we sedate patients who require sedating for painful procedures or things that are cosmetically sensitive. Let's say a facial laceration in a child or a severe tongue laceration in a 4-year-old. It's impossible to do this without some form of sedation. Another drug that we use is ketamine, which has a combination of sedation, analgesia, and amnesia, and is quite effective, particularly for the pediatric patient, but could also be used in adult patients. Please have a better understanding of these medications by the end of the month. The next principle is airway management. Hopefully you will have opportunities to assess a patient's airway and even perform advanced airway management, including intubation. This is a skill that's very critical in the practice of emergency medicine, and it's important that you understand these principles. There will be a lab on airway management during the critical care simulation rounds at the Division of Education on the 4th Tuesday of the month. It's important that you at least learn the skill of basic airway management, including bag valve mask ventilation. Once you learn this skill, then you can progress to direct laryngoscopy and then more advanced ways to manage an airway, including video laryngoscopy and use of the intubating LMA or the LMA fast track. Hopefully you will have opportunities to manage patients' airways. Lastly, there will be a variety of common emergency problems that you will encounter in the emergency department. Everything from ENT problems to minor eye emergencies or even major eye emergencies, including trauma or retinal artery occlusion, or alkali burns. It's important that you have a good understanding of assessing people with abdominal pain, chest pain, minor trauma, or significant trauma. Everything from urinary tract problems to pediatric problems, simple wound and burn care, and psychiatric emergencies. There also may be surgical emergencies, like AAAs, aortic dissection, bowel obstruction, appendicitis, among others, and many medical emergencies, covering a variety of systems. It's also important that you have an understanding of toxicology, including management of drug overdoses. Those performing the Enrich program will have the opportunity to go on consultations with our toxicologists. This concludes Module 2 of the educational objectives.